You might say that these days, the term critical condition doesn't just apply to the sickest of patients in a hospital. The words could also apply to a number of our small towns that suddenly have no hospital at all. Our cover story is reported by Lee Cowan.
There's no such thing as the middle of nowhere. After all, every place is someplace. Tonopah, Nevada, however, is about as isolated a place as you can find. There's only one road in or out. Reno is more than 200 miles to the north, Las Vegas, 200 miles to the south, and not much in between. But to those who call it home, this scenic dot on the desert landscape once had everything they needed.
Did you have any concerns about living in a place as remote as this?
No, not really. It had a store and a gas station, and I was fine.
Emmy Merrow. That's her newborn daughter, Kinsley, on her chest, and that's her firstborn, 2.5-year-old Elena, next to her. Has lived here for 4 years.
Do you want me to read this one?
Uh-huh.
Okay.
They moved here when her husband got a great job offer from the sheriff's department. But 6 weeks before she found out she was pregnant with Elena, she also found out Tonopah's struggling hospital, its only hospital, was shutting its doors for good.
I'm frustrated, I'm mad, I cry, I'm upset about it because we would live less than a mile away from a hospital.
You and me.
It was all the more worrisome when shortly after she was born, Elena was diagnosed with Dravet syndrome, a catastrophic form of epilepsy.
She's just like any other typical kid in our days, just like any other day, except for when she has seizures.
And how many does she have a day?
She's at about 400 now.
400.
Yeah.
So is there anybody within a reasonable distance that can help?
No.
When the seizures are bad enough, which is about every 6 weeks or so, she has to make a mad, desolate dash to the closest hospital, which is across the border in California, some 114 miles away. She'll never forget the first time she had to do it.
It was in the middle of the night, so it was dark and I couldn't see her. So I did stop quite often to just check and make sure she was still breathing.
That must have been terrifying.
I was sobbing the whole way. It is the worst feeling in the world.
Elaine Mingus lives here too. She came here with her husband, Kurt, for a high-paying job at the nearby solar energy plant. And they thought they'd retire here one day.
We knew that there was a hospital here and there was a few physicians, and we felt comfortable at the time.
But after the hospital closed, everything changed.
And they shut the doors, and that was it.
And they didn't give you any warning?
There was rumors.
But no one thought they were real?
No. We thought, no, that won't happen. That doesn't happen. Look, we're out in the middle of nowhere.
Kurt, who had diabetes, tried not to think about it until one night when he suddenly fell very ill.
He woke up, and I thought he was having a heart attack. He was gasping for air. He tried to get up, but he was just too sick.
He was suffering a serious complication from diabetes. It's a condition that's normally survivable with prompt medical attention. But in this case, prompt meant getting a helicopter.
And that particular night, the helicopter was 45 minutes out before they could get to the airport. And in that time, he went into cardiac arrest.
Had the hospital here been open, would that have saved your husband?
I would like to think so, yeah.
It's a grim tale repeating itself all across the country. Since 2010, 99 rural hospitals, like that one in Tonopah, have closed. That's almost one a month.
Basically, about half of rural hospitals are losing money every year. It's a large number.
Mark Holmes has been studying the decline for more than a decade. He's a professor of health policy and management at the University of North Carolina.
And is there an end in sight?
So every time that I've said, I think we're through the worst of it, we've been surprised. And you always have to wonder, who's next?
The plug pulled on yet another Tennessee hospital.
The area's only hospital is shutting down.
Several hospitals are closing.
It's devastating.
A whole cross-section of America is now facing the very real risk they'll have no local hospital to turn to.
2 hospitals closing for good, leaving
The causes are varied. The population in some of those towns has dwindled to a size that can't support a hospital anymore. In others, the hospitals are either mismanaged or they end up as table scraps and mega mergers. Medicaid expansion would have helped some stay open, Holmes says, but not all. And even so, reimbursement rates are often too low for hospitals to break even. Whatever the cause, the impact on the community is almost always the same.
The hospital closes, the emergency room dries up, all the other services that went with that, home health, pharmacy, hospice, EMS, they leave town as well, and now you're left with a medical desert.
That's exactly the fate residents of Pauls Valley, Oklahoma were worried about. The town, about 60 miles south of Oklahoma City, has only one hospital. But the previous management company had run it into bankruptcy.
I know. And I know where you are. I know where you are too, so let me...
The day we visited, the man the city brought in to save it, Frank Avignon, was working the phones to find a generous donor to keep it open.
I got 130 employees here that I'm going to have to tell they have no future.
It's literally day by day for this hospital.
It's minute by minute.
How much money do you have in the bank right now?
About $7,000.
Which gets you how far?
The next 15 minutes. I mean, it's not enough to really make a difference.
We all need the hospital because we've all...
Townspeople rallied, especially those who had been treated here, like Suzanne Blake.
How could we help?
She and her husband pitched in half of their retirement savings. Half. A gamble that to them made some good-natured sense.
And we got tickled about how much we should give. Because he said, well, without a hospital, we don't have to worry about as long a retirement.
Employees were just as passionate. Linda Rutledge, who's worked in the hospital's cafeteria for nearly 20 years, baked over 1,000 cookies. A bake sale with a lot riding on it.
What happens if the hospital closes?
I'm gonna cry. That just can't happen.
Those of you with numbers waiting for services, if you can get in line.
This is what it can look like when it does happen.
We're glad you're here. We're going to get everybody services today. We're going to take very good care of you. Yeah.
There you go, hon.
This massive free health clinic popped up at a fairgrounds in Gray, Tennessee last year. It was set up by a nonprofit called Remote Area Medical, originally founded to serve third world countries. But Chris Hall, the charity's COO, says a rural hospital closure back in 1992 forced the organization to address the medical needs of the underserved here at home, too.
Today alone, there's 7 states worth of patients that have come to this event.
7 different states.
So 7 different states, people have got in their car and driven 200 miles to get here today just to be able to get a service that they couldn't get in their local area or afford in their local area.
Some who lined up here overnight in the cold did in fact have a hospital. They just didn't have the insurance to access it.
I'm Dr. DiMatteo. You are?
I'm Leanna.
But for others, like Leanna Steele, this is the closest they have to an emergency room. Her local hospital, which she used to go to when she had debilitating migraines, also closed.
So what do you do?
Mainly just sit, hope.
Usually, before a hospital closes entirely, administrators will try cutting back on non-emergency services, like maternity wards. That's happened so often that more than half the rural communities in this country now no longer have labor and delivery units, leaving expectant mothers facing long drives at the worst of times. But in Lake, Kansas, population 2,200, they tried something different.
Oh, hi. Yes, you don't.
She has lungs.
And uses them.
Yes.
The only hospital for miles decided to invest in obstetric care instead. The thinking being that babies can be a growth industry. They get patients in the door. And just as Kearney County Hospital's young CEO, Ben Anderson, had hoped, they stay. And they bring the rest of the family, too.
Moms came here and had a great experience, and they said, you know, you're going to be my baby's pediatrician, and you're going to be my women's health physician, and you're going to take care of my husband as an internist. We're all coming to you.
Baby's moving around in there.
Yeah.
Lots.
And that's just what happened.
Baby's being quite cooperative today.
Dr. Drew Miller has a bulletin board outside his office with pictures of the future patients he's brought into this world, almost 500 in the last 8 years from all across the state.
That's the most rewarding thing of what I get to do, is take care of families of multiple generations. I could tell you stories of people that have delivered their babies and taken care of their grandma or the great-grandma. That's what I love about what I get to do here.
Ooh, your nose looks angry.
And another thing, there are no high-priced specialists employed here, not even an OBGYN.
Say,
This hospital is staffed entirely by physicians trained in full-spectrum family medicine instead.
We determined that we only have so many dollars to spend in a rural critical access hospital on medical staff coverage, so it's important that everyone's trained to do the same thing, and it's important that everyone's willing to do it equally.
A typical day for these rural doctors can include doing a colonoscopy in the OR in the morning.
Yep, let's get rid of it.
And removing a skin lesion at a clinic in the afternoon.
Are you gonna hurt me?
Well, I'm gonna try not to.
It's a flexible, can-do approach to rural medicine that has kept these hospital doors open, at least for now.
This last year, we had the first profitable year in probably 2 or 3 decades, but we're riding very, very close. We don't have the margin for mistakes.
Pauls Valley Regional Medical Center.
It's that razor's edge that hospitals like the one back in Pauls Valley, Oklahoma, had ridden for too long.
So, we just left a meeting with City.
We were there as that frantic CEO we met earlier, Frank Avignon,
You can only live on borrowed time for so long. But
brought the staff together to share some news.
And we're going to sorry.
The hospital was closing immediately.
I'm not sure people really understand what's going on. The story's got to get out. People have to see the faces of the folks in this community and the employees and what they've been through. People die because this hospital won't be open.
Tell me more.
Emmy Merrill, back in Tonopah, Nevada, understands those risks firsthand after one excruciatingly long drive to a hospital with Elena that had irreversible consequences.
She fell into a seizure that lasted 3 hours long. It lasted the whole entire trip, so she has brain damage from that. She wasn't breathing correctly. She lost oxygen.
So I think people watching this are going to wonder, if it's that bad and you're so far away from a hospital and you need, help basically all the time, why not move?
It would be great if we had the money to be able to move. We make enough to live, but not really enough to save up to be able to make that move.
As for Elaine Mingus, with her husband now gone, the rural life they love so much is gone too. And like so many who live in small-town America, she's at a loss for what to do next.
Will you stay here knowing there's not a hospital?
My home is here. I feel my husband here.
What do you think he'd want you to do? Would he want you to stay?
No.